gynecological disorder is a condition which affects the female reproductive organs, namely the breasts and organs in the abdominal and pelvic area, including the womb, ovaries, fallopian tubes, vagina, and vulva. Virtually every woman will suffer a gynecological condition at some point in her life. For most, it will be easily treatable, while for others it may have devastating consequences such as infertility or even threatening their life. A warm welcome to the Alice Makai Show. Today we have our resident doctor, Vivek Solanki, and Dr. Takudzwa Chiwanga, an obstetrician and a gynecologist at Parenyatwa Hospital and also in private practice. And today we're going to be talking about gynecological disorders. Welcome to the show.
Thank you.
Well, Dr. Chiwanga, can you just tell us what are some of the common disorders that you come across in private practice?
Quite commonly, Alice, we find menstrual disorders. So heavy bleeding, bleeding in between periods, bleeding after menopause, or the absence of bleeding altogether. We also have a lot of infections coming up, so abnormal vaginal discharges, particularly pelvic inflammatory disease. But we also find cancers, and quite commonly cancer of the cervix.
Dr. Solanki, when is a vaginal discharge considered abnormal?
You find that women present with offensive discharge, heavy discharge beyond what the normal periodic discharges are, and even irritation or itchiness.
Mm-hmm. And what really causes that?
Usually it's because of an infection, so pelvic inflammatory disease. It may also be because of cancer. Cancer of the cervix, cancer of the endometrium may also present with a discharge. Also, it may be a prolapsed fibroid, which may cause a discharge.
Then, of course, a poor hygiene, vaginitis, things like that also can cause that.
So what can one expect if they say go and see a doctor?
You can expect your doctor to take a good history. So that will include a sexual history, so you need to be quite open about that. So after taking a thorough history, the doctor will examine. Examination will usually include a pelvic examination, so you should go prepared for that. And if there's anything abnormal, if there's a discharge, they'll take a swab. If there's a lesion there that they see, they may take a biopsy. They may also do blood tests to see how severe the infection is, and anything else depending on what they find.
Mm-hmm. And how bad can a pelvic inflammatory disease get?
Well, it varies, but it can go to the extreme where you need an operation. It can lead to infertility, it can lead to hospitalization. So one has to be careful and be astute about it.
Right. And how is it treated, Dr. Chiwanga?
Usually we treat it with antibiotics. It would depend on the severity. So antibiotics can be given as an outpatient, but you may also need admission for antibiotics. And then depending on whether or not there are complications, you may need transfusion and other adjunctive treatments.
We know that many women suffer from fibroids. What really causes fibroids?
The exact cause of fibroids is unknown. We do know that estrogen and progesterone, hormones that are found commonly in women, actually propagate the growth of fibroids. But what starts the growth initially is still largely unknown.
Right. And how do I know that I've got fibroids, Dr. Solanki?
You find that women present with heavy bleeding, heavy menstrual bleeding, and it's quite unusual, but it becomes more and more frequent. They have pain. And in rare cases where they would have some swelling or abdominal distension things.
Mm-hmm. But what really causes that, heavy bleeding?
Heavy bleeding usually is because of fibroids that are located in the inner lining of the uterus. So because there's an increase in the surface area from which you bleed during your period, then the periods become heavier.
Right. But can the heavy bleeding be stopped?
Yes, it can be stopped. It then depends on the size of the fibroids and so on what intervention the doctor will choose. So they may choose, if they're small fibroids, to give you drugs, but if they're large, I think they may need to be removed, either just the fibroids or the entire uterus.
And are there different types of fibroids?
Fibroids would normally be classified according to where they are. They can be in the inner lining of the uterus, they can be in the muscle, or they can be just under the outer lining of the uterus. They may also be attached to the uterus by a stalk, or they may less commonly be found in the cervix.
What are some of the treatment options for fibroids?
There are several treatment options available depending on the severity and the size of the fibroids, and of course the location of the particular fibroid within the uterus. It can be from simple analgesics to hormone therapy, or even going as far as having surgery done.
Right. And when does it become absolutely necessary for a doctor to perform a hysterectomy?
So a hysterectomy may be the first choice. For example, if a woman has completed her family, if the bleeding is quite heavy and causing anemia or the need for transfusion, that may actually be the primary choice. Other times it's because you've tried other therapies and they haven't worked. Most commonly, those are the reasons.
Really? But can fibroids be prevented?
It's difficult to say they can be prevented because in this part of the world they're quite prevalent actually. And I don't think we can prevent fibroids. You know, it just grows and they're very slow growing, and most of the time you don't even pick it up. Some women can have fibroids of more than 5 kilograms. They carry it around, they're not aware of it.
Mm-hmm. Right. And is it possible to have fibroids while you're pregnant?
Yes. Women do conceive and have their pregnancies with fibroids, often without incidence. Some of them will grow, some will shrink, some won't change at all during pregnancy.
But what impact, do fibroids have on the fetus?
Early on, fibroids that are in the inner lining of the uterus can actually cause a miscarriage. They can cause difficulties in conceiving. Later on, there can be problems with how the placenta attaches because of the presence of fibroids. There may also be, in the case of large fibroids, abnormalities in the formation of the fetus, so fetal abnormalities because of the presence of fibroids. During labor, they can also cause dysfunctional labor. So labor can be more difficult than usual, and they can obstruct labor altogether and require cesarean section delivery.
Wow.
After delivery, the woman can also bleed because the uterus then doesn't contract.
Right, but can a surgical operation be done while the woman is pregnant?
In terms of surgical intervention during pregnancy, it's usually avoided because there's a high risk of hemorrhage. It can be considered where the woman has severe pain which is not responding to analgesia. Otherwise, it's generally avoided during pregnancy.
It's a high risk process during pregnancy to do any form of operation.
But what precautions can women take, during their pregnancy if they do have fibroids?
Well, before falling pregnant, I think it's important for a woman to visit her gynecologist and obstetrician, have a general examination done. You can have ultrasounds done, pap smears done to make sure that you are healthy and your uterus is healthy as well in preparation for the upcoming pregnancy.
So in the presence of fibroids, of course, antenatal care is generally important, but a pregnancy that also has fibroids would need a patient to go in for their antenatal care in order for all those complications to be watched out for.
Right, so which age group is most at risk?
The age group for fibroids is usually the late reproductive age. So late 30s to early 40s is when they usually present.
And on that note, we take a break, and when we return, we're looking at gynec cancers. Stay tuned, we'll be right back.
In terms of from common to less common, we have cancer of the cervix. Basically, stage 1 and stage 2A can be amenable to surgery.
Welcome back. You're still watching the Alice Makhaya Show, and I'm still talking to our resident doctor, Vivek Solanki, and Dr. Takudzwa Chiwanga, a gynecologist, and we're discussing about gynecological disorders. And in this segment, we're going to be taking a look at gynec cancers. Dr. Chiwanga, can you just tell us about the different types of cancers?
In terms of from common to less common, we have cancer of the cervix, which is the commonest in Zimbabwe, but we also have endometrial cancer, which is cancer of the inner lining of the uterus, cancer of the fallopian tubes, cancer of the ovaries, cancer of the muscle itself of the uterus, as well as cancer of the vagina and the vulva.
Right. And we know, Dr. Solanki, that the most common cancer in Zimbabwe is cervical cancer. What really causes it?
Human papillomavirus is by far the largest and the commonest cause of that, of the cervical cancers.
And how common is it in Zimbabwe?
Cervical cancer accounts for about 34% of cancers diagnosed in women. So it's the commonest cancer, particularly in black women.
It's also the biggest killer.
Yes,
in Zimbabwe, because a lot of these cervical cancers are actually picked up quite late and it causes high mortality and morbidity.
Yeah, can it be prevented, and if so, how?
The main thing we look at in terms of prevention would be looking right at human papillomavirus. So there are several ways that you can avoid it. Firstly, there's a vaccine which you can give to young girls, usually from the age of about 9 till 12, but even up to the age of 26. So you can do that in order to prevent cervical cancer when the child is older. But also screening is particularly important with cervical cancer. So screening for cervical cancer before any symptoms are present is very important in terms of preventing cervical cancer.
And how do I know that I've got cervical cancer?
You can present in different forms. You can have a discharge, you can have pain, you could have bleeding, and usually if it's in early screening, it's picked up with the early pap smear or gynae examination.
Right, and how often should we go for a pap smear?
Pap smears should traditionally be done on a yearly basis. But you find that if you are having regular pap smears and you have 2 normal ones, your doctor may actually advise you that you can have them done every 3 years, unless you're considered to be high risk, such as a patient with HIV. But if it's combined with HPV testing, you may even be able to have your screening done every 5 years. So it's something that you would need to discuss with the doctor.
And that's an important thing, isn't it now? It's HPV testing.
Yes.
I think that it's a game changer, that you can actually pick up very early and make a diagnosis and treat the patient and manage them with a good outcome.
Right, so how is the HPV contracted?
Well, it's usually sexually transmitted, so that's why the women with multiple partners or partners with multiple partners are at very high risk.
Right, and does it follow that if you have HPV, you will automatically develop cervical cancer?
No, it doesn't follow. Cervical cancer is actually a rare outcome of HPV infection. Most infections, the body with an intact immune system actually fights the HPV and gets control of the infection and gets over it. But in a minority, that HPV makes itself part of the body and then results in cervical cancer.
And Dr. Solanki, what are some of the treatment options for cervical cancer?
Depends on what stage it's diagnosed at. It can be a very simple, just a scraping of the cervix, to extreme removal of the entire uterus, including the cervix.
And the different stages of cervical cancer?
It usually spreads locally, so in the genital area, so to speak. So in stage 1, the disease would be confined to just the cervix. In stage 2, it starts involving the tissues around the cervix and also starts going down towards the upper 2/3 of the vagina. In stage 3, it can extend further down into the lower third of the vagina and also extend to the pelvic side walls. The danger with this stage is that as it extends to the pelvic side walls, it can then obstruct the ureters, which is the urinary system, and then you start having problems with kidneys and kidney function. In stage 4, you have involvement of either the urethra anteriorly and the bladder, or posteriorly involvement of the rectum. Later on, then you have spread to the chest and to the liver.
And talking about treatment options, what sort of drugs do you administer to people that suffer from this condition?
So like Dr. Solanki said, what you're offered will depend on the stage. So early stage cervical cancer would be treated with surgery. So it's quite extensive surgery where you remove the uterus and ovaries and so on. When it's in a later stage, so that would be stage 2B going up, then you're offered chemoradiation. So this is where you can get drugs, the chemotherapy. So commonly cisplatin-based therapy is given. So that would be cisplatin-based intravenous therapy. So those are the drugs that should be given. Also other drugs that may be given may be painkillers. So anything from simple paracetamol all the way across to morphine or pethidine depending. Also, you may also be given radiation, which of course is not drugs, but that's another option in terms of treatment.
But are some of these drugs safe?
Well, any chemotherapy drugs, they're dangerous. They're cytotoxic drugs and they have a lot of side effects. And of course, one has to be aware of it and we have to mitigate its effects on the body.
And then as far as the removal of the uterus, at what stage does your doctor, remove the uterus? At what stage?
Basically stage 1 and stage 2A. can be amenable to surgery. Anything beyond that is chemoradiation.
Right. How early is early detection?
Well, early as as soon as you find out. Well, the problem we have in this country is that a lot of patients present late. There's not enough awareness, and that's why we want to create this awareness out there to say, have your screening done, go for your regular visits. And the sooner we pick up the cancer, the more curable it is.
Mm-hmm. Right. And if we can pick it up as pre-cancer, then our treatment options are even better, because you can have a simple procedure. We have what we call see and treat. So if the screening method used is visual inspection with acetic acid, you can actually get treatment immediately, and it's done with. That's with pre-invasive cancer. So that's really effective. There are other options, of course, that will require you to go in for surgery, but generally, if it's picked up as pre-cancer, then the treatment is very simple.
And on that note, we take a break. Stay tuned for more on gynecological disorders.
There are several causes to infertility. Well, it can be hormonal disorders. It can be infection that you had contracted earlier in your life.
Mm-hmm. And then as far as the removal of the uterus, at what stage does your doctor, remove the uterus? At what stage? Welcome back. You're still watching the Alice Makash, and I'm still talking to Dr. Vivek Solanki and Dr. Takudzwa Chiwanga, a gynecologist, and we're still on the subject of gynecological disorders. And now we're going to be taking a look at infertility and urinary tract infections in this segment. Right. What really causes infertility?
There are several causes to infertility. Well, it can be hormonal disorders. It can be infection that you had contracted earlier in your life. It can also be due to cancers. So there are quite a few of these factors. In fact, even fibroids can come into infertility. Now, this is assuming that the woman is having the problem. Mm-hmm. Usually the man is also having the problem. So, so one has to...
Infertility issues, it's always the woman's problem.
Yeah. But it's also important early on to clarify. We don't use the word infertility so much anymore because it's rather damning and quite depressing. So we tend to call it subfertility, because often couples, whether it's with a little bit of help or with a lot of help or even with adoption, they can actually end up having children.
So what is the diagnosis for subfertility?
So we make the diagnosis when a couple, without using contraception, but while having regular intercourse and while trying to have a child, fail to have a child at the end of a 12-month period.
Right. But is it true that, taking heavy doses of marijuana, cocaine, and even drugs such as aspirin and quinine can actually cause ovarian failure?
Yes, well, it can cause subfertility, yes, absolutely. It contributes towards it. Even smoking does that. So I think any extreme of taking any of these substance abuses and things like that would affect your fertility.
Mm-hmm. So that would make it important then, if you're trying to conceive, to go in and see your doctor, and they'll take a good history, look at what drugs you're on, look at your recreational activities, so that you can eliminate all of those things that might compromise your fertility.
So what investigations may one expect if they have a subfertility?
So in the workup for subfertility, we often start by investigating the male partner, because there's only one test that we're going to do on him, which would be the semen analysis. So that's where we start off. So it's nothing against men. So I always try and clarify, it's nothing against men. Yes. So we do start by investigating the male partner. But then, of course, as we move to the female partner, we aim to look at, because one of the commonest causes would be blocked tubes, so we do a test to try and see whether the tubes are open. So that can either be an X-ray after dye is pushed through the cervix. That is called a hysterosalpingogram. So that might be an option. But if there's a history of PID and a high risk or other problems in the abdomen, then a laparoscopy and dye may be done, which is keyhole surgery, and we push dye through and we see whether the dye comes out on the other side of the tubes. Then we'll also test to see whether the woman is ovulating. So there are blood tests that we can do to check that. We'll also check levels of other hormones, FSH, LH, a host of hormone levels. Depending on the history also, there are other blood tests that may be done, prolactin levels. If there's a family history of thyroid disease, you may get thyroid function tests. So most of them are blood tests. Most of them are simple and straightforward and don't involve much pain or discomfort.
So what can one do to improve their fertility?
There's several things that someone can do even at home before you visit your doctor. So eliminating things like smoking, excessive alcohol consumption, or even alcohol consumption as a whole, because apart from affecting fertility, it is bad for the baby in early pregnancy when the baby is being formed. So alcohol and smoking would need to be eliminated. Also, it's important to have a look at the drugs that you're on. So that would require a doctor. So we do encourage a pre-conception visit so as to eliminate any drugs that can be eliminated safely in order to improve your fertility. Another thing that women can do is to maintain a healthy body weight. So that's measured by the body mass index, so your height and weight would need to be checked. Because women who are underweight, obese or overweight actually have a compromise in their fertility. And also it would also give several problems during a pregnancy. So it's important to have the weight under control if you're trying to conceive.
Right, okay. Now let's look at UTIs, urinary tract infection. What is it and what causes it, Dr. Solanki?
Urinary tract infections in women are quite common. In fact, it starts in the young girls, upwards going. So usually poor hygiene. You're prone to several infections and bacteria or even fungi that can cause this problem for you. It affects the urinary tract infection right from the urethra, right going up to your bladder, what we call cystitis, going up the urethra and up to the kidneys and causing as far as pyelonephritis.
Right. So how bad can UTIs get?
They can be quite severe. So a patient can have simple symptoms initially, so frequency of urination, pain during urination, cloudiness in their urine. And if the patient comes in early on when those are the only symptoms, they can be treated with complete resolving of the infection. Later on, though, you can actually start having systemic upset. So headaches, fever, even altered consciousness and generalized sepsis can result from a severe urinary tract infection.
In fact, if you prolong and not treat your UTI early enough, you find the symptoms may actually disappear for a while, and you find the infection then is spreading further up your urinary system, and then by the time you get the fevers and that, you've actually got kidney infection. You know, something that started as a simple cystitis ends up with a kidney infection if it's not caught early enough.
To prevent reinfection, what can women do?
They can do several things. First of all, staying well hydrated, especially in hot and humid weather, would be important. So adequate water and vegetable intake, because vegetables have a lot of water in them. Secondly, a woman can actually drink cranberry juice, which does work in terms of preventing urinary tract infections. Also, hygiene would be important. It tends to be more important in the younger age group. Women need to remember to actually wipe from the front back rather than from the back front, because bacteria that can be found from the colon and so on can actually be transferred anteriorly to the urinary tract.
In fact, those are the ones that cause quite severe infection. You know, it's called E. coli infection, and it's quite common to see. In fact, we see a lot of the E. coli infections in UTIs.
Yeah, I think mothers should actually watch the little ones, and just help them, to wipe themselves up properly to avoid getting infected with this E. coli.
Yes.
Dr. Solanki, your advice on gynae disorders?
I would say, first and foremost, be aware of yourself, of your condition, what's going on. Frequent visits to your doctor or your nurse, to the nearest health facility. Ask the questions, seek advice. That is what my advice is.
And Dr. Chiwanga?
I often say to women, in order to take care of others, you need to take care of yourself. So I encourage women to be aware of their bodies, like Dr. Solanki says, seek treatment early, and keep up with screening.
Well, thank you so much for coming through to the Alice Makaya Show to discuss about gynae Disorders. And there I was talking to our resident doctor, Vivek Solanki, and Dr. Takudzwa Chiwanga, who is a gynecologist at Parenyatwa Hospital and in private practice. And she said that in order for you to be able to take care of others, you have to take care of yourself. And if you see anything unusual, do seek treatment early, because that will prevent your situation being aggravated. Well, thank you for watching the Alice Mackay Show. And if you do have any questions, the contact details are on the screen. See you next week. Take care.